This is breaking news.
Governor Cuomo is giving an update on coronavirus in New York. Let's go to that now.
Groundbreakers. When he ran for mayor, this was really such a step forward. David Dinkins, Percy Sutton, Basil Patterson, Charlie Rangel, they were really barrier breakers extraordinaire when they were doing it. They were cutting the brush and forging a path for so many to follow. But they went first, and the first person down the path, you catch all the briars and all the scrapes. And when Mayor Dinkins was mayor, the city really had issues. But we're all going to miss him. And he was really a New York champion and a beautiful New Yorker and a mentor to me and a mentor to so many of us. So God bless David Dinkins. 2020 was a bad year, my friends. We're going to look forward to a new year. Turn on the TV news, listen to the radio. Everyone is concerned about Thanksgiving. Everyone is concerned about COVID and Thanksgiving, right? That's consuming all the news, all the chatter. Why are people concerned about Thanksgiving and COVID? And I want to make sure New Yorkers understand the facts. I don't know that they believe everything they hear on TV. I don't know that they should believe everything they hear on TV. So I want to make sure they know the facts and they make the decision for themselves. And two simple facts to keep in mind. COVID right now is on the increase. And we know how this works. There's a trajectory for the virus. When it's increasing, the increases form a line. The line goes up quickly, goes up gradually, but the line is going up. And you can factor out what's going to happen. New York has been smarter, frankly, than many other states on this, so you can see where the number is going. By our current rate of increase, we're going to see a major spike, okay? Over the past 3 weeks, statewide hospitalization rate has increased 128%. That means that line is going up. Well, what happened over the past 3 weeks? The fall happened. And by the way, every expert said this was going to happen. Oh, I'm shocked. Oh, I'm surprised. Oh, I can't believe it. Every expert said, come the fall, it's going to get cold, more people will go indoors, there'll be less outdoor activity, students will be coming home, the numbers are going to go up in the fall. Everyone said it. What happened? The numbers are going up in the fall. You look at our statewide numbers, 1,200 people to 2,800 people per day in 3 weeks. That is a dramatic increase. Look at New York City, nearly a 100% increase in 3 weeks. 484 people to 931. That's where we are today. We're experiencing that increase. Add a second fact. We're entering the holiday season. It's not really just about Thanksgiving. It's the holiday season. We know what happens after Thanksgiving. The day after Thanksgiving is Black Friday. And the day after Thanksgiving, they start playing Christmas music. And the TV commercials are all, oh, it's Christmas time, Hanukkah time, Kwanzaa, and now there are Christmas parties and holiday parties and office parties. It starts a period of celebration and more social activity. Thanksgiving to January 2nd, 37 days. 37 days of increased social activity. That's what it is. Increased social activity will increase the rate of the viral spread. Fact. Fact. Fall will increase the spread. Fact. The holiday season will increase the spread. Fact. Fact. Let's say the holiday season increases the spread 20%. Some people estimate it will increase the spread more. Some people estimate it will increase the spread less. Nobody really knows, because nobody really knows. And it depends on what people do. But let's say it increases the spread 20%. The day after New Year's, New York State positivity will go from 2.9 to 12%. We'll be at 12% January 2nd. That's just taking our current rate of increase, adding 20% for the holiday season. 12% is a high number. New York City would be at 9% on January 2nd. Number of hospitalizations would go from 900 to 2,700 on a daily basis in New York City. Those numbers and that rate of increase is more than troublesome. Today, the microcluster positivity is 4%. Statewide positivity without the microclusters are the areas that have the most intense infection rates, right, is 2.6. Overall, it's 2.9. We did 164,000 tests, 47 deaths. That number is up again. And these are not numbers, right? Hospitalizations up 132, ICU up, intubations up. We've seen this movie. We've all seen this movie. Positivity goes up. Number of people going to hospitals goes up. Number of people who go from a hospital bed to intensive care goes up. Number of people from intensive care to intubation goes up. And then number of deaths go up. That is the trajectory. This is all too predictable at this point. Positivity goes up. You will then see the hospitals go up. You will see the ICU go up. You will see the intubation go up. And you will see the deaths go up. And that is exactly what is happening. So, this Thanksgiving, we urge caution. But it's really not going to be just this Thanksgiving. It's really this holiday season is the problem. It just starts on Thanksgiving. Everyone is talking about just Thanksgiving. It's the day after Thanksgiving, Black Friday. It's going to be the same message. When we start to get into the holiday season, it's going to be the same message. New York rule is celebrate with no more than 10 people in your household. This caution is not a political issue. Everything now gets politicized. It's amazing how divided the nation is. It's politically divided on everything. And even on this issue of safety precautions on COVID has somehow become a political issue. This has somehow become a political issue. I don't know how, but it has become a political issue. You hear the opposition, pro and con, on these safety measures for Thanksgiving. It's now a political issue. This is not a political issue, because it doesn't matter what side of the political line you're on. Both parties agree on this one point. Well, I'm a Republican. I voted for Donald Trump. Donald Trump's CDC, his Center for Disease Control, reports to him. His CDC says only celebrate with people who are currently in your household. Only celebrate with people currently in your household. That's Donald Trump's administration. Don't invite people over. Don't bring Aunt Nancy over. Don't bring Uncle Joe over. Currently in your household. That's the Trump administration saying that. The Joe Biden advisors say the same thing. When is the last time you heard the Trump administration and Joe Biden agree on anything? Name one thing that they agree on. But they both agree on this. What does that say to you? What does that say to you that both sides agree on this? And what is the basis for the political opposition? Both sides agree on this. If you voted for Donald Trump, this is what he says to do. If you voted for Joe Biden, this is what they say to do. Maybe they're right. And maybe we shouldn't politicize it. So, that means this is not going to be a normal Thanksgiving. This is not a normal Thanksgiving. It wasn't a normal Labor Day. It wasn't a normal Memorial Day. It wasn't a normal summer. It's not normal in school. It's not normal at work. It's not a normal Thanksgiving. I know. And it's hard. I know. I know. And we all live it. It's hard for all of us. It's hard for me. I had thought Thanksgiving was going to be the end point. My rationalization in my head all through COVID, early on through the summer, when we get to Thanksgiving, then we can all be together again. I just needed to believe that it would be over. So I said to myself, Thanksgiving. That's when we'll all be together. It'll be Thanksgiving. It'll be Thanksgiving. And now we get to Thanksgiving. It's not Thanksgiving. By the way, I believe we're going to get to Christmas, and I believe it's not going to be Christmas. The vaccine will not be distributed by Christmas. I think you're going to see the numbers going up through the holiday season. I had my daughter Mariah, who's in Chicago, on the phone crying that she can't come back. She feels isolated in Chicago because she talked to a doctor who said, you know, if you get on a plane, even if you take a test, you then get on a plane, you could get exposed on the plane, you go through the airport, you could get exposed through the airport. And by the way, you can take a test today, but if you'd been infected in the past few days, you can test negative and still have the virus. My mother, I didn't have the heart to talk to until last night. She's older, and she just doesn't understand it. And I had the conversation last night. I had the same conversation with her this morning. She just does not understand it. She's 89 years old. And you start to think, you know, how many Thanksgivings do I have left? And she says, and she's right, you know, I haven't seen my sisters. I haven't seen my nieces and nephews. Yes, I know. It's all true. But it's not a normal Thanksgiving. So I think of it this way. It's not a normal Thanksgiving. It's a special Thanksgiving. It's special. This Thanksgiving is more profound and deeper than most Thanksgivings. This one is more symbolic because this year we're giving thanks for all the people who sacrificed for us through the year. All the people who were heroic through the year. All the people who gave their lives for us during this year. All those essential workers who I asked to go to work, and they did it. I mean, it still amazes me. I was saying to New Yorkers, think about it. It's dangerous, stay home. Keep your children home, close schools, close businesses, stay home, stay home, stay home. But you essential worker, you have to show up tomorrow morning because we need you to drive the bus, we need you to drive the train, we need you to run the utility plant. Nurse, we need you to go. Doctor, we need you to go. Ambulance driver, we need you to go. Food store clerk, minimum wage earner, we need you to go to work so everybody else can stay home. And they went. And they died. That's why this Thanksgiving is special. There are tens of thousands of families who lost a loved one this Thanksgiving. Tens of thousands who lost a loved one. Their father's not there, their mother's not there, their grandmother's not there. Tens of thousands. This Thanksgiving is more special. And this Thanksgiving reminds us we have a bigger family than we think we have. Our family is not just our immediate family. It's not even just the extended family. What we did together in New York showed that we are the family of New York. Those essential workers showed up like they were your brother or your sister or your mother or your father. That's the dedication that they showed. That's the love that they showed. So this Thanksgiving, we're celebrating it with the broader family of New York. And this Thanksgiving, we're remembering the less fortunate. Why? Because we're New York tough, and part of being New York tough is to be smart and to be united and to be disciplined and to be loving. And to remind people, because we're creative in New York, and we have style, fashion capital of the world. We have style. We have a beautiful new mask design. Don't be a turkey. This Thanksgiving, wear a mask. We also cut to the chase as New Yorkers, right? We have a way of saying things where we cut to the chase. Don't be a turkey. Wear a mask. And you look good wearing this mask. Jealous, aren't you?
I'm actually going to thank you for it.
Jealous.
I'm going to ask you a question.
Jealous. I've been told I look better in this mask than without this mask. I've been told the more I cover my face, the better I look. That's what I've been told. So, wear a mask. You can have this special edition turkey mask. We're going to be giving them out today and tomorrow. And just think of the family picture, standing with these masks on. Questions?
Regarding the mayor keeps saying that that you are going to impose new restrictions on all of New York City, possible orange zone restrictions. But just to be clear, that can be done in a limited fashion, correct? I mean, it doesn't have to be done over the 5 boroughs. I just wanted you to clarify on that. And do you anticipate any other areas where additional hospital space will need to be built out, given that there's this expected spike?
Both good questions, Mr. Fink. I'm going to give you an extra mask so you can have one for a significant other. We have a micro-cluster approach, which is a neighborhood-based approach. Why? Because the numbers are very different in very different neighborhoods. In Manhattan, you go from, what was Lennox?
0.69 or something? Yeah.
0.69. In Manhattan, you go from 0.6 in some neighborhoods to 4 in some neighborhoods, right? Why, if you have a neighborhood at 4, you need to slow down the infection rate in the neighborhood of 4. Why close down businesses in a neighborhood that's doing better? Makes no sense. Why close down schools in a neighborhood that's doing better? Makes no sense. We're trying to keep schools open, K to 8. Junior high is a different story. So we do micro clusters, which we have done. We have been doing. We did a Brooklyn microcluster, Queens microcluster, Staten Island microcluster. And then if sometimes they're effective, and we've actually seen microclusters go backwards in infection rate and remove the restrictions. Sometimes the infection rate continues to grow, and the microcluster grows, right? Or if it grows geographically, or it increases in severity, and it can go from yellow to orange to red. We announce those as it happens. Even in those zones, the schools close, but the schools can reopen because we believe in open schools K to 8. They have to, the protocol is they close, they clean, they retest, and they reopen. We announced the most recent data and microclusters. We have nothing new today. I don't anticipate. Do we have anything new tomorrow in New York City?
Not unlikely in New York City.
So we are where we are. We won't have any new announcements on any new data. And it will be neighborhood by neighborhood. Could every neighborhood go up? Theoretically. This holiday season is going to be the big question mark, right? By this projection, it's just a projection, New York City could be at 9 on January 2nd. Could you be at 9 and have some neighborhoods under 3? You could. But you have to see, and it's what we do is a pure correlation to the numbers. On the hospital beds, Staten Island has the worst situation in New York City. And I want to reinforce that point about the politics. If you voted for Donald Trump, his administration says only your household, which, by the way, is different than what they're talking about in Staten Island. I'm going to invite my uncle over and my cousin over, and that's how we do it here. Trump administration says don't do that. So then you're following your own guidance. Then you know better than the Trump health advisors, and you know better than the Biden health advisors. You're in an elite echelon of health experts in the nation who second guess both Trump's and Biden's health experts. But anyway, we've had a most significant problem in Staten Island. That's where we have an emergency facility. We don't anticipate that anywhere else now.
Despite the microclusters, the way you've spoken about it in the past, and even the mayor has been speaking about it, is that the entire city is expected to go into an orange zone. Today, the mayor said that he expects the city to go into an orange zone in December, and that he can't begin reopening schools until the city's in an orange zone. So is that not the expectation anymore, that when the orange zones come to New York City, that it will be the entire city? Is it now a neighborhood by neighborhood approach?
No, I think we're disconnected on both facts. There is no citywide number beyond the collective of the individual numbers. See if they can find the zip code slide from yesterday. Not the zip code, the neighborhood slide. You look at the city, you have different infection rates all across the city. Queens, Nassau, Queens, Bronx, and within Queens, different numbers. Any one of those neighborhoods hits 3. Well, first it hits yellow zone, then it hits orange zone, then it hits red zone, neighborhood by neighborhood. For an entire city to become an orange zone all those neighborhoods would have to hit 3%.
What if the city's number hits 3%?
The city,
Your numbers.
well, it depends on, is it a concentrated, this is the spread of the numbers. Breezy Point is at 6. Parts of Staten Island, 5, 4. Kingsbridge, 3. Is it possible that all of these numbers would be showing 3s as we go through the holiday season? Yeah, it's possible, especially if you think you're going to wind up at 9. I'm trying to say it's a function of the way we behave. And if we're smart, that doesn't happen. But it could happen. And then at 3, let's say you do hit 3. Now the schools close, but they can test to reopen, like we just did in Brooklyn a couple of weeks ago. That was an orange zone, and that was a red zone. Schools close, schools clean for 4 days, test all the students, reopen with increased testing. You have a point, Melissa?
Yeah, I think that what the governor's saying, just to punctuate his point, is that at this point, what you see is more concentrated areas within the zip codes, and of course, we're watching the city as a whole. The big X factor is Thanksgiving. When we were driving over here just now, there was much more traffic on the streets than we've seen probably since the beginning of COVID. We look at the Port Authority numbers, we look at the numbers at the airports in upstate New York, you're seeing an increase in travel. And so the question is Thanksgiving going to be the thing that tips it over? Instead of seeing what you're seeing with these concentrated pockets where there's variations, are you going to start to see an overall rise across the city, across the state? And the interesting thing that we had seen up until now with COVID is what you see based on cell phone data, what you see based on contact tracing, is that people are more likely to stay in their immediate neighborhoods. A lot of people are still working from home. You're not in a situation where people are getting on subways and going to the other side of town or going to other boroughs to eat. You're not running around seeing your friends constantly or shopping. People have maintained mainly to their neighborhoods much, much more than pre-COVID. So the question is, what happens at Thanksgiving? And the even scarier part is that last Friday, CDC put a report out that said 24% of people that give COVID to someone else never develop symptoms, and 35% of people that give COVID to someone else are pre-symptomatic. So the fear, in addition to all of that, is that there are people that think, I'm fine, I'm okay, go. 24% of people who have COVID never develop symptoms, give it to someone else without realizing it. 35% are pre-symptomatic. So the big X factor, I think, is around Thanksgiving, around the holidays, what happens to the overall percentage and rise as you see people increase socialization, as you see people from different households get together, and you see travel increasing.
So just to be clear, this is the New York City projected rate, assuming a 20% increase to the current increase because of the holiday season. You start at 257. You'd be at 9 on January 2nd. Is it possible that in December you have every area over 3? Yeah. Yeah, that is possible. As far as the state policy on schools, we leave it to the local governments up to 3%. And the local government has total flexibility up to 3%. Today, New York City could open every school. They could close every school. Nassau County could open every school. They could close every school. It's totally up to them. I have delegated authority to them up to 3%. Up to 3%, then close, clean, test, and reopen. And that is a statewide law superseding any local jurisdiction. So it doesn't matter what the locality has done up until that point. That's what happens at 3. Am I saying, are we saying the same thing now?
Yeah. And on Staten Island, you mentioned Donald Trump. I'm wondering, do you blame the borough's politics on it becoming essentially, the entire borough becoming a hotspot, given it is less crowded than the rest of the city? Or are there any other factors that explain how the entire borough has become, has come under a yellow or orange zone now?
It's a function of personal behavior. Look, this is a political symbol. We know that. Everything gets politicized in this society. COVID became a political debate during the presidential campaign. How, why, I don't know. I put rules out. There's opposition to the rules. The opposition to the rules I put out is primarily political, right? What I'm saying is, let's get past that on COVID, because it's a matter of health. There is no Democratic theory of health or Republican theory of health. It's just health. And on this issue, it doesn't even matter. There is no political divide. The political divide, let's say it's symbolized by Trump voters and Biden voters. Both agree on this guidance. By the way, the CDC guidance is stronger than the New York State guidance. New York State says you can't go above 10. CDC says only people who have been in your household. Only people who have been in your household. If it's just been you, your significant other, and one person, that's it. No one else can be invited over. Not your brother, who's part of your family. No one but your current pod household. CDC guidance is stronger than the New York City guidance. So if you're Staten Island or if you're Manhattan, doesn't matter. If you're Democrat or Republican, doesn't matter. You voted for Trump, you voted for Biden, doesn't matter. They both have the same advice. So maybe they're right.
The 20% projection, can you talk about how you came up with that figure and how much you're relying on people to do the right thing as opposed to authorities like the Sheriff's Department to enforce some of the social distance rules?
I believe this is 100% driven by personal behavior. The local enforcement has been minimal at best, always. Always. I have lamented about the lack of local government's enforcement daily. I've lamented about New York City's lack of enforcement, only using sheriffs. I've lamented about local governments. I've supplemented them with state police, et cetera. But I don't believe it's about government enforcement. We have 98% mask compliance, not because government does it. It's because people decided to do it. All I've done throughout all these briefings, it's not a question of the government rule or the government policy. I only lay out facts, and I believe New Yorkers are smart. And if they hear the facts, they will arrive at the right conclusion, and they have. It's never been because of the sheriffs or the state police or anybody else. It's because people have done the right thing. I could have never enforced stay-home policy. Government can't enforce social distancing. Government can't enforce mask wearing. Government can't enforce any of these things. And that's why I'm so proud of New Yorkers. They did it. Nobody can enforce how many people you invite home for Thanksgiving. Nobody's going to come and knock on your door and say, let me count how many people you have in your home. That's not what it's about. It's about giving them the advice and the facts and showing them the numbers. So they say, I do this not because I'm afraid government is going to give me a ticket. I think we handed out like a handful of tickets in the state on masks, right? I mean, like a handful. It's because they're smart, and they want to protect people, and they want to do the right thing. And that's what I'm saying about Thanksgiving. Nobody's going to knock on your door. You're going to do what you're going to do. I understand that. But here are the facts. And well, it's easy to see the political issue. It's easy to dismiss. Oh, yeah, that's a Democrat saying that. You know, those Democrats. Oh, that's a Republican saying, you know, those Republicans. Both are saying the same thing. So maybe you should listen to it. The 20% is just a pure projection. The projection is, let's assume, with all this increased social activity for the holiday period, more people on planes, more people on the roads, more people shopping, more people going to people's homes. Let's say that increases the virus 20% above the current rate of increase. Just a projection. That's where we wind up. People are more reckless. Can the 20 be higher? Yes. Could the 20 be lower? Yes. It's a pure function of what people do. And that's why this has been such an amazing period. You want to talk about how government is supposed to work. This is how it's supposed to work in the textbook. I give the people the facts. I tell them what I know. They decide. I'm not enforcing this. They sell this little cartoon of me looking in the window on Thanksgiving. I'm not looking in your window on Thanksgiving. Nobody's looking in your window on Thanksgiving. You know everything I know. It's up to you. And the results are going to be decided by you. That's it.
Governor, you spoke yesterday about the importance of not gathering. You spoke about it again. Then later yesterday, you spoke about planning a Thanksgiving with your mother and your daughters. What led to the turnabout, and then the second turnabout that you wouldn't dine with them? I said
my plan was to be with my mother and 2 of my daughters, which would have been 4 people, which is well within the 10 people that we set. One daughter couldn't get back from Chicago. I have 3 daughters. And that had been the current plan that we had been talking about. As I said to you before, I had always been talking about Thanksgiving as the day that we were going to be together. But I also said in the same discussion, that's the current plan, but the plan is subject to change, and that I have to work. And because of that, it's not, well, I'm going to be working, but it's also not smart for me to be with my mother because I'm working. With a senior citizen, which she doesn't take that back. If I call her a senior citizen, I'm in trouble. With a mother like mine, you want to be very careful. I could take a negative test just before I sat with her, and that does not mean I'm negative. And if I gave it to my mother, it would be a bad thing. What I could have done is I could have stayed home after yesterday until Thanksgiving, quarantined for 3 days, if you will, and then taken a test and had no exposure. That would have been safer. But none of this is foolproof, but that would have been reasonable and safe for my mother. Like, let's say I wanted to see my mother on Thanksgiving. I could have stayed home yesterday after the last event I did, press conference, stay home until Thanksgiving, take a test. I didn't see anybody else for 3 days, have 4 people, which is within our guidance. But I have to work today, which is what I'm doing, and tomorrow. So I wouldn't, it's too risky to see my mother.
That statement not contradict what you had preached earlier in the day. You're bringing your mother up, your daughter's up, we're going to get together. And that's what it sounded like. That's what it sounded like.
Didn't. I never said, that's 4 people. The rule is less than 10. I never said to anyone, you should be alone. Everybody.
Combining pods, though, bringing people from outside your immediate circle.
The CDC's guidance is only your household. I just said their guidance is stronger than ours. Ours is no more than 10. You can be with your mother. A lot of people are going to be with their mother. Safe is you should be quarantined, removed from other people, and take a test. I'm not in a position to do that. I'm going to work today, I'm going to work tomorrow, and I'm going to work on Thanksgiving. So that would be reckless. But, yeah, you have to, people should celebrate Thanksgiving. Just do it smartly and intelligently. You can be with 4 people. We say you shouldn't be with more than 10. CDC says don't bring anyone else into your pod. But, you know, nobody said sit alone in your room and lock the door, right?
Hello?
Me? No, we're going to have dinner together because we're going to do a Thanksgiving briefing. So you and me and Zach, Peter, we're all going to be together for Thanksgiving.
You're down here.
I don't know. Why, you want to do Albany here? Maybe we do both.
We can Zoom you in.
No Zoom. No Zoom. I like something about feeling each other's presence on Thanksgiving.
About New York City and the 3%, I think some of the confusion is just that Mayor de Blasio seems to be waiting for all of New York City to hit a 3% in order to figure out a strategy to reopen schools, to test all the students out, to work on that. Are you in communication with his administration to figure out how to reopen those areas that are not at the 3%?
Yeah. Yes, but that's not the issue. The issue is the mayor closed the schools because by the mayor's calculus, he hit the point where he said he would close the schools. The city calculates their numbers differently than we do. The number happened to be 3 in both cases. Our 3 is a firmer 3 because we require that it be in place for a longer period of time. So it's like a more conservative 3, if you will. But he hit 3, and he closed the schools. It's totally in his discretion now. When it hits 3 on the state scale, then the state law kicks in. Right now, it's up to him. Okay, guys? Don't make plans for Thanksgiving, Zach. All right, be safe. Let's give out some turkeys.